Bima mpya ya afya ya SHA, ambapo waziri wa afya Deborah Barasa anazungumza na vyombo vya habari ili kufuatia mgomo kutoka kwa wahudumu wa afya ambao wako chini ya mpango wa UHC.
And the citizens on how to access services under the digital model. For our focus on primary healthcare remains a top priority. UHC is designed to drive more people towards the primary healthcare services, ensuring that diseases are detected and managed early before they escalate into costly emergencies. Utilization data for January 2025 clearly confirms that we are on the right trajectory. This will also reduce the pressure on higher level hospitals, ensuring that referral facilities focus on complex cases while primary healthcare facilities handle routine care, preventive health, and early disease management. We call on Kenyans to embrace primary healthcare services, which will be more accessible, affordable, and effective under the new system. At this point, I would like to invite the DG for Health, Dr. Patrick Amoth, to take us through the key updates on transparency in health financing, digital transformation, as well as facility management. Dr. Amoth, over to you.
Thank you, Madam Waziri. Just to...
It's okay.
Where are the bosses?
No problem, no problem.
Okay, thank you. Thanks, Madam Waziri. I think you have been very, very comprehensive in your playing the background, and therefore I'll just put emphasis on a few areas. I want to emphasize the fact that data from utilization of facility data for the month of January is clearly indicating a shift of our patients moving from higher level facilities towards the primary healthcare facilities. You know, primary healthcare services or facilities are comprehensive, they're integrated, they promote equity and inclusivity. And this is a good thing happening for us, especially the dwindling donor space. Therefore, we can be able to stretch the shilling to be able to deliver more health. In the month of January, we had more than 406,000 visits, and the majority of those visits were to public health facilities. We are proposing to pay about 877 million, 54% of that will go to public health facilities, unlike the previous past, where the private facilities have received a bigger chunk of capitation payment. Again, this will also be able to remove that barrier that was created by pre-chosen facility. Now, based on this, because we reduce the number of people who have registered to budget, it means you can be able to go to any facility. You are not restricted to a particular facility to receive services. Facilities will be able to submit returns upon which then SHA will be able to make the reimbursements. So it gives you the latitude that you are not restricted. If you come from Kwale and you are in Busia, for example, you will be able to receive the services. Busia, the facility in Busia, will lodge the claim with SHA, and SHA will be able to pay that money. So going forward, the money is going to be at the facility level, and we want to urge the county government under the FIF Act to be able to strengthen the committees at the health center level, the dispensary level, so that upon receiving the money, they can be able to prioritize procurement of health products and technologies, especially medicines, laboratory commodities, and also the requisite equipment to ensure continued service delivery to the people. Waziri has talked about the means testing. We are finalizing this on Friday, the day after tomorrow. It will be more robust, more user-friendly, and you'll simply log into the system and put in your ID, and based on the data that is in the back end, then you give us a consent and we'll be able to determine how much premium you are going to pay. As at yesterday, more than 3.86 million Kenyans have done means testing. We urge more Kenyans to be able to complete that journey. But also linked to the means testing is to ensure that you onboard your dependents. Please, Kenyans, when you do the entire journey, make sure that your spouse and your children are on the system, because you could be up to date in your payments, but if you have not onboarded your dependents, they will not be able to access the services. Then, in terms of capacity building of the healthcare workers. We know the challenges that we have gone through. We are developing a manual together with SHA and the consortium to be able to explain to the healthcare workers the journey that they need to undertake as they offer services. And we are hopeful that in the next 2 or 3 weeks, this manual should be up and running, and it will be a reference document that one can be able to refer to at short notice to ensure that patients continue to receive services. That is coming from the fact that many times people go to the facility, the health worker who is dealing with you is not familiar with the system, and instead of asking for help, he or she tells you that SHA is not working just because he or she is not familiar with the system. And because they don't have a document to refer to, then that becomes a challenge. So we believe working together with the counties and other providers with this manual, we should be able to assist any person who is coming to seek for services. Our CEO is seated right next to me. Payment for facilities is going to be a public thing because it is public money. I want to assure you that, and CEO will confirm, that the money that we paid from claims dating from 1st of October to 31st of January 31st of January 2025 are up in the website for anybody to be able to see which facility was paid, how much was that facility paid, and it is subject to the public to be able to view that information. If there's any facility that does not appear in the published list in the website, please reach out to SHA management for clarification. We also want to appeal to the health facilities to be able to onboard on the Health Information Exchange System. DHA will be able to give support, especially to the public health facilities, so that you can be able to run all your systems through the system. We have also finalized our call center in partnership with Safaricom. We have signed a service level agreement with Safaricom that a call that comes, I think, is given 20 seconds. At the ring of 20 seconds, every call that comes through shall be answered. And we are going to beef the capacity of the call center to be able to respond to all queries raised by providers and Kenyans seeking healthcare services. As at yesterday, more than 20.2 million Kenyans had registered under SHA. Remember, in the previous NHIF dispensation, in the more than 50 years of existence of NHIF, that number was 9 million. We have been able to onboard an additional 11 million Kenyans in a span of just 5 months. So Kenyans are embracing, joining the Social Health Authority platform. And remember, universal health coverage is a journey. It is not an event. It's not something that you begin today and tomorrow you have achieved. So let's work together as one whole community, address the challenges as they come collectively. I am glad the system is now very, very stable. We don't receive any complaints of the system being down, and therefore things will only get better if you work collectively. Thank you, Madam President. Questions?
Mtazamaji, mkurugenzi mkuu hapo Patrick Amoth akizungumza na vyombo vya habari kuhusiana na hali na mustakabali wa afya. Hii ni baada ya wahudumu wa afya walio chini ya mpango wa afya kwa wote UHC kugoma na pia kuandamana. Mtazamaji, kumbuka hili limekuwa likitukia kwa zaidi ya mwezi mmoja sasa. Bila shaka mwanahabari wetu wa masuala ya afya Elizabeth Teno atakuwa akitupasha taarifa hiyo kwa njia kamilifu kwenye taarifa zetu zifuatazo. Mtazamaji, tuchukue mapumziko mafupi. Endelea kusema nasi kupitia mitandao yetu ya kijamii.